Do you know what our hospital bed capacity is? And are you getting routine updates on those?
Right, so I don't have that information handy. I know that our Emergency Operations Center is getting that information daily. And what we're working on is getting an automated dashboard up. I think the first version of that is going to be up today with public health data. And then there will be more information added, including hospital bed capacity and other breakdowns on what kind of beds and ventilator and ICU beds are available. That is in the works.
Is there an overflow site if the hospitals reach capacity, or?
What I know is that they've done a lot of continuity of operations planning. What we also know is due to preparedness funding over the last few years, they've got all these what I call pop-up units, if you will. Mostly they're used for triage, not for actual treatment of people. And I believe last time they used them during H1N1 to appropriately triage people and get them through different lines of testing.
These are like tents that would be.
Right,
yeah.
right. What else do they have planned? If they have any overflow sites, that's a hospital question. I'm not fully aware of their plans. But the EOC would have a little bit more detail, and of course the hospitals themselves will tell you more.
You talk about the data. I mean, one thing that's been consistently true is Tarrant County hasn't been putting out as much information as surrounding counties, especially Dallas. Why is that?
So we're starting to put more out like we did today with our news release about the deaths. And the general reason why we haven't been putting more out is when there are few number of cases, like, first few that happen, and there's such an intense interest, like everybody's looking at things under a microscope, the likelihood of somebody's privacy being compromised is higher. Now that we have several hundred cases, 288, even if I gave you some generic information about a couple, 3 cases, it's going to be very hard for people to figure out where this is. So the privacy of the individual is protected, so we're sharing more information at this point.